Good morning.
Morning.
As I said this morning, we're very busy doing clinics. We've completed actually in about an hour, we will have completed our 9th clinic. So that totals probably well over, by the end of the day, 1,608 separate clinics. That's a heavy lift. We're working very closely with Rick Sauer, with emergency management, and with DPW and with the Sheriff's Office on our emergency plan to scale up and get ready to pick a date in March to go to SUNY Sullivan, have the volunteers ready, working with one of our staff members who is putting all of this together in conjunction with Dan and actually John Little and myself and a couple of other people, making sure that we have everybody appropriately credentialed and vetted, and we know that they're appropriately licensed, they're trained to provide vaccines. We'll have both medical and non-medical, as well as people who are allowed to give vaccines under the current executive order exemption, like EMTs and dental hygienists and dentists and so on. There's a long list.
So this is for the increased population that's going to be affected on the 15th of February, where you're immunizing more people?
Well, once we get to that date, I'm sure there will be quite a few more eligible people.
Right.
So
as long as we have the vaccine, right.
The week that we get the vaccine, when we get it, we also get instructions on who we're allowed to give it to. So I'm sure it will.
And hence the problem.
Well, I'm sure by the time we get to that point, which is only in a few weeks, that essential 1B category will have opened wide, and we'll be able to register a lot more people.
You're looking at a central location to do all of these immunizations.
Mm-hmm.
Has there been any thought to coming out to the remote towns and senior centers to immunize those particular individuals?
Yes. So here, we've been doing a lot of planning around this, and it's there's a lot of moving parts and pieces to this. It's very difficult to plan. Once you have your plan in place, which we have for many, many years, we've been doing this for 20 years. I was here in 2009 when we did this for H1N1, and we stood up clinics. At that time, all of the healthcare providers in the county were also getting vaccine, not just us and not just the hospitals. So the plans that we've had in place, which is part of our health emergency operations plan, went by the wayside. That's true for all counties because there's a different process that's being followed. So from week to week, we will know what's expected of us, who we can give it to, and how much we're getting. We're asking to have that planning process be loosened up and to give the counties more control. So we are looking at outreach. We've been planning and discussing with Sun River because they have a mobile van, and we talked with them a few months ago about partnering. They're more than happy to help and have us partner with them, go out to these outlying areas. We've done flu clinics at senior centers for years, years and years.
Nancy and Nadia, but it all sounds good if we weren't in a pandemic, but I mean, the way I look at it is if we have 8 people at a certain facility, isn't it better off leaving the nurse and the people at the facility doing shots, continue working, and then go out and get a bus, bring them in like an express line, go through the express line, and then bring them back and then go somewhere else. I mean, because you go back to the same facility 6 times, you get 1 or 2 people.
Well, that's not what...
just bring them here and keep the process going.
Not what I'm even implying. I think that if we could organize a particular hub in a certain area and have those people come. Some of these people can't just travel very easily.
Yeah.
So we have to come to them. Yes, it's very easy to have a centralized location, but what about these outliers and people that can't be mobilized?
So
anyway,
eventually,
that's what I'm talking about.
Yeah, eventually when we get to the point where we've been able to, as a county and with all of our healthcare partners, vaccinate, do the large ones first, and then we can start fanning out in a few months and doing the outreach. But Hudson River Healthcare and Refuah are the two federally qualified health centers that we have in this county, and their mission, and they are funded for the purpose of serving the underserved and hard to reach. Those without transportation, those without health care or health insurance, communities of color, people who are not as likely
Underserved.
to have a regular health care provider. So in addition to public health, we partner with FQHCs. They will also hopefully be getting more vaccine as the weeks roll out.
Yeah, and you would still have the centralized area where people are coming in and getting immunized.
Yeah.
So the whole gist here is to get as many people immunized as possible.
Right. We just ask everybody to please be patient because this is going to be a while. This is going to take a while, even with a huge number of vaccines, if the pipeline opens up. We're looking at, tens of thousands of people. So it's going to take a while. We will coordinate information and put it out on our website and out on social media as we get more updates available. I just saw something come across about Walgreens and CVS now will have vaccines starting next week. Now, it depends on which county you live in, and it depends on which pharmacies are participating. So there's
I had them yesterday.
a lot of details to this.
Alan?
So.
Yeah, I would, I'm just a legislator, so I would recommend that we defer to our healthcare professionals who are on top of this to, roll out the program. Unfortunately, at the state level, the state has decided to supersede plans that have been placed at the county level for decades now. Otherwise, this would probably be rolling out much more smoothly. But, I think we got to have faith in Nancy and her team. They're doing what they need to do in accordance with the cards that were dealt to them from the state. So,
I have every faith in what they're doing. It's just when you have seniors calling you as to where they can get it, they can't get it an appointment online. It becomes overwhelming. So, on their behalf, I'm requesting that at some point, we can get out to the towns and to the seniors and to their centers. If we obviously have public health nursing that have been
Right.
doing flu clinics that can get out to these areas, and not to impact on the centralized location, that would still be operating,
Right.
And the pharmacies, but to get to these
So I'm.
areas where they just
You're
can't
right.
get out themselves.
You're absolutely right. I'm going to go back to the earlier point I made, which is the state tells us what we're allowed to do.
Right.
We received a one-time allocation of 600 vaccines for the seniors 65 and older. That was it. We're not getting any more unless they give us more. We're continuing to ask. They have determined that the pharmacies will be the primary access point for our seniors going forward. Now, we're pushing back on that. A lot of counties are pushing back on that because especially in this county, we have a lot of independent, really small pharmacies and maybe one or two larger ones. They don't have the capacity, and the healthcare providers are also pushing. Let us vaccinate our patients.
That's right.
Our 65 and older, our seniors,
Crystal
our
Run, yep.
people with chronic disease. So we will
Absolutely.
continue to advocate, but we also have to follow
Right.
the guidance that's given to us.
But we
And
have to-
believe me, I'm getting emails and phone calls from people
Yeah.
every single day. So are my staff. Heartbreaking.
It is.
So, yeah.
And trying to reach out to everybody.
So we will continue
yeah.
to push out information as more pharmacies and more providers come online in a coordinated manner so that people can go to the county website and see, okay, who's got it this week and who's got more and who else is participating that wasn't last week.
Right.
I don't envy your position,
Thank you.
especially we're probably, this legislature or in public service, we probably have more information than most, and it's confusing to me. A couple questions though. How many people do we have on the list now that registered when we first opened it up, when it was going to be for the over 65, which now, from what you're telling me, you're not vaccinating, so these people are expecting to get a call back where they're not going to get to this point because you don't have the authority to do it. And the next question, which is really part of it, talking to the public, everybody's upset and they're complaining and they've registered.
Yeah.
Now, a lot of them are registering in multiple locations. So
Right.
now when it's their turn, I'm sure it makes it more complicated. You hear you were planning to give it to them, they went someplace else. So now you have it set aside for them and you're not using it, so.
Yeah.
If you
Yeah,
can
when we created that notification system, it was with our seniors in mind especially, and people without internet access to have a phone number to call through the Emergency Community Assistance Center. Dan, do you want to give an update on that notification system and what we're planning to do? Because there's a whole separate group of people helping our department with that process as well. And as we go, we're making tweaks as information changes, because we realize we have all these seniors signed up, and now the state is telling us we may not be getting more vaccine for this particular group. So we are planning on how to address those issues.
I'll just be brief because I spoke about this last week as well. I haven't gotten the latest count, but I think we're well over 7,000, probably over 8,000 people on that notification list. Some of that is duplication, but I would say it's safe to say at least 6,000 to 7,000 verified individuals, and that is from inside the county and from outside the county, because we don't discriminate in the notification list part of it. Again, this is notification, not registration. So this is only a means for you to be notified at this point of an upcoming county-run clinic, although we are talking about expanding that if we find out there's other clinics, but we'd have to do that in concert with our partners. Once you get that notification, you still have to register for that. So this is an attempt to try to give everybody at the same time the same chance to register, to be notified to register for a clinic. And then, of course, as you've heard, what happens, typically these registrations go exceedingly fast.
Oh, yes.
Nothing we can do
Like a
about
blink.
that.
Mhm.
Yeah. But
So someone who's on that list who thinks they're on a list to get a call, that's just to be notified?
it's to be notified. We've made that as clear as we possibly can on that notification list. That's all it is. And in fact, today we're going to do a test run of it with a notification just that we are testing the system. And we're going to re-emphasize in that message, this is to be notified of an upcoming clinic, of which there's no notification to give today. But that's going to happen today via email and via recorded voice message, depending on what way they chose.
Ira.
Just to ask a question, because I'm a little confused myself now. When we first opened it up for the seniors and they were going online to register, I didn't think, that was to register or to notify?
Right, that was to register through the state's registration system. This is not, we have our own notification system we created to let you know, okay, this registration page that's through the state, we have control over opening it, but it's a state-operated system. All right, that's now open. You can now go here and register, or at least attempt to register, because if you're not one of the ones to get there within the first few hours, you probably will be out of minutes. It may be. You'll probably be out of luck. That's how much in demand this vaccine is.
And that was in relationship to, thank you, Dan, that was in relationship to the one-time allocation of the 600 doses. That's when we put the registration link up on our website. It was full in 2 hours.
This is a fiasco.
Good.
Ira.
So like,
Yeah.
I'm just using one example, I'm certainly not mentioning names. This person thought they registered, they saw the number go down from the count, there was a glitch supposedly in the software and it wasn't registered. Now this person called up your department and their name was put on a list. So is that a list to be notified or a list to get the shot?
So now we're getting into the weeds, but CDMS is the state registration system that we're required to use for registration. It does have glitches now and then, but also people have had issues where they didn't complete the final step after they registered, and they did not hit the little button at the bottom that says submit. So we've had a few of those, and then they call us, and then we try to get them back in and get them registered. Put them on, if it's full already, then we put them on what's called a standby list, so that at the end of because they registered, and They were there, and they had a spot, or so they thought, but they didn't hit submit, so they didn't get a confirmation. So we have a standby list, and if we have extra doses, which we often do at the end of the day, and then our staff start calling and try to get those people in the same day. Yeah.
Boy.
So there's a lot of moving parts to this.
How complicated this is.
Yes, it's a fiasco from the start, and it has nothing to do with our people. It has to do with the federal government, the state. You know, the more people that are sticking their nose into this, the more convoluted and complicated it
So
gets.
what I'd like to
That
be
was my
able to
point.
do, but I know that I won't be allowed to, is to just have people, come in every 10 minutes, and what you used to do in the old days is just, mark their arm like you're going to some kind of, parade or something.
yeah.
You've been here, we know you got your vaccine, go, bye, But it's a lot more complicated than that, because we have to collect data, and we have to collect immunization data in terms of the state knowing when will we get to the point when a certain percentage of our population has been vaccinated, which groups highest risk have been vaccinated. That's the kind of data we need to get through this pandemic. So,
One last question then.
Yeah.
So someone's in a category of over 65 and they're compromised where they're either have cancer or a cancer survivor. Does that put them in a different category?
yes, when the immune compromising conditions and chronic issues have been added to the category and opens up as eligible, it doesn't matter what age they are, they'll be eligible.
Okay.
Yeah. So they could be eligible for more than one category.
Yeah.
We've had that with some of our firefighters. Some of them are over 65, so they were able to get in that group early on when we had that one-time allocation. But we also had the essential worker category 1B for law enforcement, firefighters, and so on, so teachers.
I'm just hoping that this gets easier once the J&J gets authorization.
Yeah, that'll be a one dose.
Yeah.
We're hoping to.
Yeah, we're hoping.
Because you will see that we're bringing seniors back starting the middle of next week for their second dose. That's not an additional 600 seniors. That's the first group of 600 seniors that we did that are coming back for their second dose. If we're eventually able to get the Johnson & Johnson or some other vaccine that's just a one dose, it'll simplify things.
Yep.
So, yeah.
So thank you for everything you've done,
Yes.
but it's not your fault. Don't misunderstand what I'm saying. It's just
Yeah.
this whole
It's very
thing. It's just so
complicated. All the counties are
Yeah.
in the same boat. I do have some good news.
Oh, good.
I mean,
You're not giving a test on it.
that is
but
good news.
I don't know if I pass it.
So we spoke about this about a year ago. A resolution was approved for us to participate in a research study with New York Medical College, New York University, sorry. And they applied for a grant through the National Institutes of Health, and they were awarded. And so we're embarking on this research project, and it's called The Impact of the Food Environment and Other Environmental Exposures on the Risk of Diabetes in Rural Settings. That's a mouthful. Basically, people are going to start getting surveys in the mail. We did this a few years ago. It'll be from us, but it's on behalf of NYU. They're doing all the mailing, they're randomizing, all choosing randomly all the residents. They have to be full-time residents. They complete the survey, they'll get a $10 gift card sent to them directly from NYU, not from us. So we're just facilitating this process. We're not really deeply involved in it, but we are partners with them. And as a result of the last research study that we participated with them in, actually a New England, I don't remember which journal, it was a very prestigious journal that published their article and their findings, which I think I shared with you all. That was a couple of years ago. So this is a continuation of that. And, the hope is to show the relationship between access to healthy food and diabetes prevalence. And we're working in a lot of ways with a lot of our partners on improving access to nutritious food and improving the health of the county.
Good grant. Congratulations.
And we have, I'll just stop there because I've gone on long enough, but our Certified Home Health Agency, as you know, continues to have the highest census that we've ever had. We're scheduling patients out on the weekends. We're also pulling some of those staff in to help with our clinics, so there's a lot of juggling in terms of scheduling staff that goes on with that, but we're continuing to, we have benchmarks that are, the majority of our benchmarks that we've been tracking on our dashboard, and after this meeting, I'll follow up and send you the most, I think it's in my report, actually, the monthly report. Most of those indicators are in the green, which is good, which is improved in terms of productivity, in terms of patient caseload, in terms of quality outcomes, and finances, and we're moving in the right direction as we have been working very hard on this for over a year and a half. So that is also a piece of good news, and I'll end with that unless you have any other questions.
Nope, thank you for everything that you guys are involved in. Thank you. Good luck.
Thank you.
Thank you.
Keep the faith.
Stay safe.
Be safe.